This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone. Welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis. Should be hopefully interesting conversation today. I was recently at a low-carb health and metabolic conference and met lots of people. This doctor was one of them, and I'm just going to introduce him as Dr. K. I'll let him say his name, kind of a long name, but he is a critical care doctor in the Ottawa Hospital. He founded the Resource Optimization Network, which is a multidisciplinary research group working to decrease healthcare spending without compromising care. That's a big task. He also hosts his own podcast called Solving Healthcare with Dr. K. His topic was very interesting. He basically was talking about using some lower carb strategies just to improve one's, metabolic health, and how that maybe translates into doing that in a critical care type setting. So just kind of anxious to hear what he has to share about that. So Dr. K, welcome to the show.
Thanks for having me, Greg. I'm excited.
All right. Well, so for the listeners, I didn't want to butcher your name, but tell us, how do you pronounce your name?
It's Kwadwo Kyeremanteng.
Okay. Yeah, I wouldn't have got that right. Is it okay if we call you Dr. K?
Sure.
Okay. Tell us, I guess, just a little bit about you and what you do. And then from there, I guess I want to kind of ask how you got into kind of the nutritional side of things, but just kind of tell us a little bit about what you do.
Yeah, the short version is I'm an ICU and palliative care doc. Did my training in Ottawa, did my med school in Edmonton, or E-Town as we like to refer to, Oiler Nation. And I fell in love with critical care relatively early. It was fourth year of medical school, and so did internal medicine, trained to be a critical care doc, also fell in love with palliative care, so did that simultaneously. Saw tons of inefficiencies in the healthcare system, so decided to get a master's of health administration and try and develop ways to reduce spending and improve care. Developed, as you mentioned in the intro, a resource optimization network. And then I was realizing that little was changing despite producing good research. And so we decided to launch a podcast, and life has been a roller coaster ride ever since. So yeah, we started the Resource Optimization Network, noticed that little was changing despite producing what I would say high quality research. So we decided then to start a podcast, Solving Healthcare, and life got crazy after that. My life has changed in so many ways, and that's probably one of the main reasons we got to meet in Denver.
Well, let me ask you this, because you said you noticed a lot of inefficiencies in the healthcare system, which is, probably an understatement. And I'm in the outpatient setting, you're in the inpatient setting, and so I don't know much about that world. But I'm sure both of them are bad and have a lot of inefficiencies. But what I find is that most doctors just kind of go along with it, and they just like, yeah, this is what we got. And I guess they don't question it much, despite, it seems pretty apparent to me, a lot of obvious inefficiencies. But you noticed that, and it sounds like, right off the bat, and then started to at least try to do something about it. So what made you do that? Because most doctors just don't. I mean, they just kind of go along with it.
Yeah, good question, Greg. I think it's the value, like my personal values, and one is like fairness and justice. And when I often give this story when I talk about our research program. I was taking care of a young trauma patient in my training, and this guy, we worked hard to get him off the ventilator. Like he was trached, basically had a tracheostomy, so like a tube that goes from the neck into the trachea. We he had regular chest physio, which he was really reliant on to clear his secretions. And we go into a long weekend, and he doesn't get his chest physio, and he plugs up and gets a pneumonia, and we start from square one. And it's because it's an era of cuts, physios aren't available on the weekends, and I'm like, this is the most short-sighted BS I've ever seen. Like we weren't able to achieve this guy's care needs because we're short-sighted in thinking that cutting our allied health was going to get us, is going to be, yes, we're going to reduce our budget that year, but long term it's going to be worse for patient care, and it's going to cost more because one that poor guy that is now, instead of being another 2 days in the intensive care unit, is now another 3 weeks at $3,000 a day. So to me, I was on a mission to just illustrate how inefficient things are, and that was our best. That was what we were most talented at, is showing the spots where we were vulnerable. And most of that, I mean, if I'm being like 80-20, it was really around like people being admitted to ICU that weren't benefiting from ICU. So you got people that had very poor prognosis that despite that was still being admitted into the ICU. People weren't having those tough discussions on whether they're going to benefit or not. And so that was a big area for us. But really it was the what I saw, and then the values of justice and fairness, and knowing that if we were more efficient, we could be more available for the people that need us the most. And so like there was a voice inside that just was like, we got to do more. And that's how I was raised. That was, I feel like my parents, any of my siblings would do the same thing. Also, I'm part of an area of Canada. I think that they're not too far. They're not. We're not too shy to voice when things aren't going well. And yeah, I think it's a mix of all those things, Greg.
So, we had a pandemic recently, and that seems like it exposed a lot of the inadequacies of our healthcare system. With what you do, I mean, I'm sure you have plenty of stories to tell. And you were right in the thick of it, being in critical care. But talk about that experience as far as being a critical care doctor during the pandemic, and just maybe what you saw in the view of all these inadequacies of the system.
Yeah, that's a great point, Greg, because really that's what COVID did. It showed us where our weak spots were. And I mean, being front line with this thing, it was crazy. Honestly, it was, you look back at this time and it was wild. Like we were front and center. I was there for our very first ICU patient at one of our sites. It was scary. We seeing everything that was happening in other parts of the world, but at the same time, it was something special in the way that we all came together. Our team came together. We bonded. We've never felt so close to my colleagues, nurses, physios, respiratory therapists, because we had a common goal, and it's to get people through that crazy time. And honestly, the nerves went down relatively quickly because you realize not everyone had the same risk. We were able to protect ourselves, and then at that point, it was really about, like, at least socially, was trying to really inform people on risk factors, especially the metabolic disease. But yeah, the actual experience was crazy, and it was kind of, it was nice to hear the people getting behind us too, like they would do things like clap at 7 o'clock or honk their horns, and and like all those kind gestures. And we did a little fundraiser of feeding the frontline staff, where we try and support local businesses, that like restaurants that were closed, and try and support the staff workings of the healthcare providers, so to provide them with some meals to kind of boost the morale. But yeah, it was different. And then the hard part was, the other hard part was seeing people die by themselves in that first wave. That was a hard pill to swallow. You'd meet these people that just lived an amazing life, that were good to their family and friends, and we didn't see the big picture and provide them with, a really dignified death in that sense.
Yeah.
But yeah, and then I mean, so yeah, and getting back to your original question too, about like what the gaps were. So the gaps were clearly long-term care. Like, we really did not serve our long-term care patients well. We really need to provide them with better resources. The low socioeconomic areas, with those essential workers, people living in multi-generational homes, we had to do a better job there. But yeah, there was so many gaps, and it really got exposed over the course of that pandemic.
Yeah. I've talked about this before, but, I feel like that, the government could have used this pandemic as a tool to get people healthier, and to come out and say, look, if you're metabolically healthy, you're at significantly lower risks for this virus. And, here's how you get healthy. And, we never heard any of that. Why do you think that is?
That's a good question. And I think one of them was the risk of, like, people didn't want to come across as fat shaming, which I think is, in my opinion, is ridiculous. Because when it comes to life and death concerns, if I am metabolically unhealthy or obese, and I knew that reversing that would reduce my risk of dying from COVID, I would want to know that. And if somebody's going to give me some guidelines on how to get myself better, I would be behind that. Like, there was so much fear. People were ready for action. It was a completely missed opportunity. As far as, like, I agree with you 100%. It was pre-vaccine. It was summer months, spring, summer months. Like, let's get outside. Let's work out outside. Here's a workshop on why you need to avoid processed foods. I think all the, like, whether you were low carb, keto, whether you're vegan, whatever, we could get together and on a common mission and talk about how to get folks healthy. It just seemed crazy. So I think I wonder about the fat shaming. I wonder about just people feeling like it's not realistic. Like, I was late to the game to realize, like, you could reverse type 2 diabetes. Like, how
Same
easy,
here. Yeah.
Like, I shouldn't say easy, but how quickly you can reverse type 2 diabetes. I had no idea. And I'm trained as an internist. You know what I mean? Like, I think part of that was like a defeatist attitude, but whatever it was, it's sad that we didn't do more.
Yeah. On that note, so talk about your journey, because, I've talked a lot about this before on here, but, I was never really taught in medical school really about the importance of metabolic health and how that can, like you mentioned, reverse type 2 diabetes and many other illnesses, and the importance of nutrition in chronic disease. I mean, I was really never taught any of that. So when did you kind of discover all of that in your career? And then how have you been able to implement that with the type of work that you do in a critical care?
Yeah, so it was the pandemic. It was absolutely the pandemic that sparked it for me. So it was clear, as I mentioned, obesity, type 2 diabetes, metabolic syndrome was associated with poor outcomes. And then I was having a lot of conversations to folks saying, okay, let's get people healthier or whatever. And then one of the producers on our show was like, oh, you need to talk to Jason Fung about reversing type 2 diabetes with fasting. I was like, what are you talking about? Elroy. They're like, yeah, no, you could reverse type 2 diabetes. I'm like, come on. Yeah, after 5 years or whatever. They're like, no, weeks to months.
Yeah.
I was like, stop it. So I get Jason Fong on the show. My mouth is open like this the whole time. I'm like, what? Then I get the low carb folk. I get Rob Wolf, or got Ken Berry, got Diet Doctor Brett Scher on there, and I'm hearing all this, and I was like, what the flying f? Like, why aren't we like? Let's get the word out. Okay, tell everybody. And I mean, you don't know this, Greg, but like in Canada, I was doing national media like once a week at least, talking about COVID updates, and so I was trying to get these producers. I was like, this is what we're seeing. Can we talk about metabolic syndrome, please? Nobody was biting. Nobody would want to. Nobody would dance with this shit. You're sorry. I can't. I don't know if it can.
You're fine.
Right. Nobody wanted to talk about it. So I was on a mission on our platforms to learn more and to get the message out. Had a low carb conference even, just to see if we could get the message out there. But yeah, I was late to the game, Greg.
Interesting. So since you have learned all this, how has that changed, I guess, what you do in the hospital? Because it's I feel like it's probably easier for me on the outpatient setting, to follow up with people frequently and see how they're doing, and monitor that. But you're with them probably for finite amount of time, and they're really sick when they come to you. So has anything changed for you in the way that you treat people since you have kind of learned all this?
So far, we have made no changes in my clinical practice, but more towards research, like where we need to, our next steps for research. So we recently put out a paper on why, like, making a case for low carb nutrition and in critical care. We often there's a lower carb enteral feed that we can go to, which I push more. So there is that slight modification that that I encourage, but we need the research to really try and initiate some change here. And yeah, one of the modifications that we've been proposing is a lower carb feed, and also adding a fasting element. Like, we feed our patients 24/7. Who's to say like that's beneficial? And it's food that has like a high glycemic index, and really, I think the path forward is to evaluate this and hopefully start that practice, like, assuming that there is some data that will support that lower carb, or maybe I should say the high carb, high seed oil content that we're giving our patients is not benefiting them.
What has the reception been like with your colleagues, with you talking about all this stuff? Because a lot of times when I talk about this, people sometimes refer to me doing alternative medicine and, whatever. When you kind of start veering away from the standard of care, sometimes, your colleagues kind of raise their eyebrows and stuff. So what has that been like for you, just even, mentioning this type of stuff?
I've been highly encouraged. A lot of people come to me saying for their own health, not so much their patients, but their own health, saying, I want to take off those extra weight. I just started blood pressure medications. What do you think? It looks like my blood work is showing that I'm pre-diabetic. What do you think? I saw you talking about low carb. I saw you talking about fasting. I learned a lot. Do you have any other resources? All these things have been what people approach me about. The general vibe is been very positive, actually. I think it'd be different if it's treatment for patients. I do think there would probably be a little bit more resistance, but because it's I'm not pushy about it. I'm that's not my style. Like I like, for example, Greg, I don't know if you're low carb or keto, but my kind of practice I've been doing is fasting. I don't push low carb. I don't tell everybody they need to be fasting. I don't tell everybody they need to be low carb. I just say, like, these are your tools if you want to achieve a goal of saying improving your metabolic, improving your reducing your risk of metabolic syndrome. Like, these are the tools that I know of and that are effective. And you know, you got to find out what works best for you. But I'm not going to push one thing over another and saying absolutely this is the ticket to all patients.
Gotcha. Okay. And so you said for your own life, so you now incorporate some intermittent fasting, and has anything else changed for you personally since you've kind of gone on this, discovery of metabolic health and stuff?
Oh, personally, I've gotten reduced I'm a relatively fit guy, but I've my muscle, like my fat percentage has gone down. I feel like my energy is up. Like, the mornings are way more convenient now that I've been introducing fasting. I love working out in a fasted state. I feel way more energized. I I just feel better, and I it's just something that suits me so well, especially because I like to eat, right?
Mm-hmm.
Like, and so I will, I was at we had a function at a restaurant the other day for our work. I had two entrees. I'm like, I was fasted. I had a good workout day. Walked to the restaurant. I'm like, this duck confit ain't gonna feed me enough, son. Give me the flank steak as well. And obviously had some eyes towards me, but I'm like, I don't give a damn. This is what my body needs.
Yeah.
But it allows you to, as long as you're eating good food, as far as I'm concerned, it allows you to just have that liberty to not get anxious about the quantity. And yeah, it just suits my lifestyle well, and I feel great.
Yeah. Very nice. So you have a podcast called Solving Healthcare, and that's kind of what, as we mentioned, you study and are going towards. I'm not real optimistic, just because I feel like there's so many things are ran by big pharma, and it's all about the dollar. But how, and this could be a long conversation, but how do we solve healthcare? I mean, in a quick summation, like, what are some major steps that we could do to solve the healthcare crisis?
So I'll say what's most efficient, or would it be efficient way. I do think there's some low lying fruit, like, and we're different areas, but like little things like every doc should be able to practice everywhere in my country. Like, we shouldn't have restrictions for province or for states for you guys. Like, that shouldn't be, in my opinion. If you're a nurse in Ontario or New Hampshire, you should be able to practice in New York, especially, like, go to a place of need. Like, there shouldn't be those barriers. We should make sure those that are foreign trained, that qualify, get jobs that are needed. I would leverage virtual care more. I would use personal support workers to the best of their abilities. Allow nurses to do nursing things. Those are some of maybe the quick hits. But the most important thing, in my opinion, would be to invest in prevention, like incentivize prevention. That to me is the no brainer. And the problem is, most governments or even hospital administrators, they don't see some of them feel they don't have the ability to look that far ahead because they gotta balance the budget before the election or before their term. A lot of this is going to be a long-term investment, but when I tell you, at least in Canada, you admit somebody to an intensive care unit for a COVID admission, that's about $50,000. That's one patient, and imagine what you could do with that amount of resources when it came to prevention. That same COVID 53-year-old diabetic obese patient, if we put in 10% of that into a health coach, into encouraging, like, really teaching them how to eat well, for them having some ability to have access to some form of fitness, that could not only is life changing, but it's also like it's an investment in people. It's showing that we care. So I think if I had a magic wand, that would be where I think we need to go, because we know we have the information, we have the knowledge. It's just, in my opinion, we're not investing in the right areas. Like in most systems, especially in the US, you guys don't need to invest more money.
Yeah.
Like there's no need to invest more money.
Yeah. Yeah. And I feel like too that, we did change our educational system a little bit in, talking about medical school, and at least incorporate some of these strategies, because like you, I was never taught, how to get somebody metabolically healthy. I was never taught the benefits of fasting. I was never taught any of that. And so just starting with incorporating some of these things in medical schools, and teaching doctors and healthcare providers, okay, this is how to get somebody healthy. This is how you can prevent, insulin resistance and reverse type 2 diabetes. I mean, it's not even taught. And so I think just starting there would be, a good place to start. So.
Be huge. It'd be huge, because like, think about the impact. Like that's why we loved, like, our ideal avatar for people to hear us out are young healthcare professionals, because they amplify these messages. Like if you're a single family doc that's seeing, I don't know how many people that are pre-diabetic and diabetic, think of how many lives you could truly save by implementing some of these strategies.
Well, so talk about what's next for you. So now you've kind of opened this door to, metabolic health and the impact that has. And so you're doing this podcast and meeting all these new people. So you said your world has kind of changed. So where are you going from here? And talk about that.
Yeah, Greg, I think when it comes to what the future looks like, we've done our best to increase the awareness of these issues, and now, to me, it's about implementation and showing that we can make a difference. So we got a grant locally here to look at underserved communities, the Black community in our city, and see if we, in a virtual format, can help the pre-diabetics and diabetics and reverse their metabolic syndrome through nutrition and exercise and stress management, and see if this could be a model of care moving forward. Going to continue to get the word out, as many speaking engagements, as much as the content that we can produce to empower folks to get healthy. I mean, that's one of the joys I have, is a bit in the content creation. So even the podcast, but even the social media, like we do a lot of social media posts about how to get healthy. And I've learned over the last 3 years, like it's hard to predict what the future will look like. We have a fairly reasonable newsletter on Substack that has been also an avenue to try and empower folks. But I've learned to kind of, maybe sometimes you just ride the wave a little bit and see what the opportunities take you. And I mean, if you asked me 3 years ago, I'm going to be talking in Denver about this topic, I would have thought you were crazy. And so I kind of just riding in the wave, see what opportunities come, but with that principle of getting the word out and trying to create change.
Yeah, very nice. Well, so what's the best place for people to kind of follow you and what you're doing?
Yeah, the most efficient way is if you go to our Substack, it's kwadcast.substack.com. So KWADCAST.substack.com. That's where we house our podcast, our video content. We have ebooks on metabolic health. We have courses. We try and put it all on that magical spot, so then it's easy to find. Otherwise, on social media, you go at Kwadcast. We're on Twitter, TikTok, Facebook, Instagram. And the podcast Solving Healthcare, you can find it anywhere you listen to podcasts. But honestly, Greg, what an opportunity. I really appreciate being able to come on your show. And I know these conversations, I know truly can make a difference. I'm sure you get that on a fairly regular basis from friends, from colleagues, fans, that, having these conversations like this could spark something in somebody. And so I just want to commend you for all you're doing and continue the hustle.
Well, thank you. And same to you. Appreciate what you're doing. And before I let you go, my listeners know I always kind of finish up by asking my guest if they could give us one health tip that could make us healthier today. What would you say to that?
I love that question. And it's because it's changed every year a little bit. But today I wish I could give a couple. But for nutrition wise, I would just say increase your protein intake. If you do that, everything gets better. Lean muscle mass, insulin resistance gets better. You're fuller. You feel better. You don't have as much swings in energy because your glucose control is better. It's just a nice hack to win at life. And I aim for a gram per pound for myself. I usually have a bit of a tough time getting there, but that's my goal. But I think if everyone amps up their protein, so much of life improves.
Yeah, love it. Yeah, I couldn't agree more. So, okay. Well, Dr. K, love what you're doing, and I really appreciate your time and expertise, and appreciate everyone listening, and we will talk to you next time. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like, you can check out our website at vibrantlifedc.com, or you can email me at drgreg@vibrantlifedc.com.